Ah, yes, part 3. This is the one where I teach you why you have to use this new, longer method to go through questions. It's worth it. Let's talk about why. So let's go through a question. A 74-year-old man comes to the office due to 4 months of problems of old age. Problems of old age. That could be hearing. He can't pee. Maybe he can't get an erection. Can't remember things. He's depressed. His wife died. He's lonely. Hungry. Lost. Can't remember things. Confused. Malnourished. Seriously, there's no way to know. There are way too many differentials here. He has daily temporal headaches and feels quite fatigued. So he is tired and he has these headaches. Maybe he's got some neuro problems going on. Maybe he falls and hit his head. Maybe I don't know. There's no way to know. Maybe he just has headaches and that's his thing. Patient's ears ring. His eyes become blurry intermittently. Okay, not ringing any bells, but sounds bad. Both feet feel as if someone is sticking them with pins. Okay, so neurologic for sure. He's got something neurologic going on. Maybe he's got MS, 74-year-old guy. I don't know. I used to smoke cigarettes, but now he uses vaporized nicotine. Okay, we get it. He vapes. His medical history is unremarkable. Is it, though? Sounds like he's got a lot going on. You're telling me it's completely unremarkable. 98.4 degrees, normotensive, normal pulse, well-appearing. Oh, he's well-appearing. Well, he sounds great. There is moderate cervical lymphadenopathy. Dude's got big lymph nodes. What's he got going on? Cardiopulmonary exam is normal. Hepatosplenomegaly is present. Okay, he's got these lymph nodes. I haven't thought of anything yet based on all these neurologic things, and I'm still trying to figure out what kind of problems with old age he's having. Fundoscopy shows dilated, segmented, and tortuous retinal veins. That's something. That's super specific. I wonder what that is. Sensory deficits in his feet, so he does have something neurologic, I'm convinced. But reflexes and strength are intact. Lab results. I have a bunch of labs. He looks anemic. His platelets are fine. White count's fine. His CBC's fine. So I don't know what's wrong with this guy. Problems of old age. What could they possibly ask? Serum protein electrophoresis reveals a sharp IgM spike. That's highly specific. Which one of the following is the most likely diagnosis? Okay, IgM spikes, electrophoresis, white count is normal though. I wonder what the answer choices are going to be. Alright, looks like white cell malignancies. Based on this IgM spike, I can start to rule some of this in and out. Now it's kind of making sense what I'm supposed to be doing with all this information. But quite frankly, he had so much going on in the beginning that now I need to go back up and figure it out. So the IgM spike does really rule me in quite a bit. So the issue with the top-down approach here is you don't know which direction to point your brain. When you start this question, you have no idea what they're asking you. They go in 1,000 different directions. Maybe it's neuro, maybe it's vascular, maybe it's something totally different. Turns out it's a malignancy. What you want to do is frame the question for yourself, not in the format of what you would see in clinic. In clinic, sure, you got to work top down. What's your chief complaint? Let's go from there. In this test, you don't have long enough to do that. You've got to look at these answer choices and figure out what are they really asking? What is the question writer wanting you to demonstrate that you actually know? And in this case, it's the differences between several of these white blood cell malignancies. Looking at these answer choices, I realize I want to know some things. Oh, I see multiple myeloma on there. Does he have back pain? Does he have anemia? What's his calcium? I want to know this person's age. If you'll remember from the first video, the core idea is that each one of these diagnoses has an etiology, a pathology, symptoms, diagnosis, complications, and different treatments. Those are the things you need to know about each one of these diagnoses to separate them apart and then to look through this stem and figure out which specific thing the question writer wants you to use to separate these apart. So back to what are they really asking? Here's an example of what they do not expect and what I do not expect and what you should not expect. 74-year-old man, 4 months of problems with old age. That really speaks Waldenstrom macroglobulinemia to me. No! That's ridiculous. How would you figure that out that fast? Why start from the top and think about all the hundreds of diagnoses instead of looking at the answer choices and figuring out what they're really asking you. If we go back through this question, again, we're going to read the question, answer choices, etc. The question is, what's the most likely diagnosis? Then we classify the answer choices. These are all white blood cell malignancies. Okay, I know some of the differences between these. I know some of the symptoms are different. I know the age distributions are different. Then I'm going to read the prompt and highlight. First, I've been given some labs. Looks anemic. Platelets are fine. White count's fine. Okay. In the presence of a white cell malignancy, I have a normal leukocyte count. That's probably pertinent. Sodium's normal. What I'm noticing, though, is I don't have a calcium. So like with multiple myeloma, I would expect some changes in calcium. They haven't even given me calcium. So that's probably not what they are asking. They're not asking me to distinguish these based on calcium and calcium alone. You could reframe this whole question to be asking the difference of these malignancies and their effects on calcium, for instance. But alas, you work back through this, you highlight the pertinent things, and you end up with this very specific amount of information at the bottom of this sharp IgM spike, and you're able to rule in Waldenstrom macroglobulinemia and multiple myeloma, and you're eventually able to rule in Waldenstrom macroglobulinemia as the answer choice here. The point of this lecture was to prove that you shouldn't get lost in the STEM to start with. Focus on the answer choices and go from there. Next, let's talk about algorithms and how to rule these answer choices in or out.